there are so many different forms of keto. True keto is 3-to-1 fats to protein.
Well, my comment about the fact that some people need to increase their fiber and support with fiber, the guy was like, there's no research to back this. This is a stupid comment. I was like, okay, well, also when someone's like literally like on carnivore, for example, and Joe Rogan talked about this.
Shitting their pants.
With, literally shitting their pants. But Joe Rogan and I want to say it was Brigham that maybe had this discussion about how they do see that people do better with a little bit of fruit and fiber in there.
Absolutely.
It's like, just because it's not fucking research doesn't mean that person doesn't. I mean, I know if I'm going to shit my pants. Like,
I can't with some people. And also, like, that's one thing. I was listening to one of Alex's YouTube videos, and one thing I love that he said, he's like, some people feel really good on keto. Some people feel really good on carnivore. Some people feel really good on high carb. There is a huge genetic predisposition to all of this. Like,
we were also like, how could we ever fix metabolic issues and blood sugar issues with using carbohydrates? That was one of the other comments.
It's a fucking inflammatory problem. It's not a carb problem.
No, but Art's like, go and respond to these. I was like, no, just like everyone else does. Like, you're not going and responding to them. Did you get clip-ins?
I did. One of them's like kind of falling on. It's itching me. It's okay. They work well. They're really easy to put in between. Yeah, for the in between. Nick watched my stories and found out how much they were, and he's not happy. We were at Easter, and he was watching golf and like scrolling Instagram, and I was in the kitchen with my mom and my sister. He goes, your extensions were $285 that you bought in between the week? I was like, they make me happy, okay? Your round of golf in California was $350, so suck it.
And that was like what?
It was 3 hours long.
3 hours.
These are going to last me forever if I ever want to have extensions and not actually have extensions.
Oh my gosh. Okay, we ready?
Yes.
Happy Friday.
Happy Friday. We are here to talk about some more fun stuff that can happen in pregnancy.
Fucking pregnancy.
If it's not already rough.
So we have an episode coming out with Stephanie Crossweller.
We're going to do a series.
We love her, adore her. And we were chatting after just how fun it was. She's like the third person to we're like two peas in a pod. She's like the tripod effect.
She is our sister from another mister that we just never knew. Like, Stephanie we didn't think there were many people out there like us.
There's not.
We're pretty awesome. But
okay, well, let's define this here. Why we're apparently so cocky. No, we're talking about the fact that entrepreneurs in functional health with children, loving our children. I am obsessed with Ethan. I'm also obsessed with Marcus. He's the best. But at the end of the day, I just know that I'm not meant to be like the stay-at-home mom. It gives me joy and fulfillment to work and to help other people. So anyways, the whole point of me bringing this up is that we did a podcast with her on her podcast, and we decided that we're going to start a segment on female just entrepreneurship and the real truth about this. Because we talked a lot about pregnancy and postpartum, and many people love being pregnant. I did not have bad pregnancies. I was never throwing up, really, really sick. I had pain, but I think that's normal in terms of like third trimester, all the shit's expanding and you're just,
pain.
Widening in every way possible. And we were just talking about how as much as it is a beautiful thing, we're so thankful for our children. We also know that getting to a place where you feel good again, hormonally, just not even thinking weight here, but like hormonally and your confidence and your mental clarity, it just takes some time. It takes a bit of time.
Yeah, no. And I think of the three of us, I probably had it the worst from what it sounds like. Pregnancy and postpartum. And again, I love my children, and there is no wrong belief system here. Like, people that love pregnancy. They are not wrong. People that don't like pregnancy and postpartum, they are not wrong either. It's just, I feel that there is more of a negative connotation towards the people that express that they don't like pregnancy and postpartum. Like that it's out there. It's more of, oh, it's a beautiful time, embrace it. And it's like, I mean, I'm living through it. I'm fine, but I don't enjoy it, nor do I want to spend a very long time here. Like,
there's a reason why it's more of like an acute thing. The baby starts sleeping through the night after like 6 to 8 weeks, because sleep deprivation is just horrible. And then when you're managing like multiples, so Ethan's going to be 4 months this weekend. So we're recording a little bit ahead of time. And yeah, I mean, Art and I both have had these situations where like, oh, like maybe we would have wanted a third or, whatever. And I'm like, I'm happy. My heart is fulfilled. I wasn't fulfilled, before when we were trying for so long. Would I be upset if I got pregnant again? No, but I also would not want to redo the first, I would say 8 weeks of, newborn life. Yeah. It's a little rough for people.
Breastfeeding, it was one of those things that like I did it and it was fine while I did it. But I was also someone, I do not lose weight when I breastfeed. I pretty much stay like stuck at, what I lose initially. And so however long I breastfeed is however long I like still kind of feel, like I'm like, none of my clothes fit anymore. And this sucks. And I don't feel confident in how I look. And yeah, I'm doing it because I know there's a bigger purpose and I was able to keep up. But yeah, it's just like everyone has different experiences. And we talked about that on the podcast. And we talked about, our thoughts and views as business owners and moms and wives. And I think we're going to do some more podcasts together and share our thoughts because I don't think there's one out there like that. I don't think that, a lot of the people we look up to don't have kids and I still look up to them and what they accomplish, but like talking from that aspect of trying to juggle everything and being a female in that, business owner role. And
I think what's unique about Becca and I, and, again, this will change in the future, but we still take on one-on-one clients. We are still very involved in the client journey. And many people that I look up to have stepped away. They don't take clients anymore, right? You work with their team and they're not overseeing all of the cases the way that we do in our practice. And that's very hard. I don't know that we'll ever not be involved with our practitioners and overseeing cases just because number one, we care about our clients and we have such an investment in them the way they've invested in us. But number two, that's also kind of what makes us tick. And so I think to be a really good practitioner and to stay, we are constantly learning and evolving. And, one of the values of our organization is continuous education and always be evolving. I don't think that you could not have some personal clients and still be doing it in the way from like a functional health perspective, right? Because it's so much to keep up with already, just with what we'll even be talking about in the coming weeks between peptides and, all of the new research and things that are really coming out because there's more and more that's evolving every day. And then now we've gone through this pandemic and now they're looking at some of the research that maybe was skewed and finding out new things. And so it's just giving you different ways to think about things. So anyways, throughout pregnancy, I had several women reach out to me about cholestasis. And so I made these notes in my phone and then I forgot about them. And one person messaged me and now I was like, you know what? We're going to do a podcast on it because it'll be a good resource for people to have and to help women understand what are the true risk factors, because I think that this is very, very scary. If you're not familiar with what cholestasis is in pregnancy, it's a liver condition where bile acids back up. They're supposed to flow from your liver, right, to your gut to break down fats, remove cholesterol, remove toxins, sequester toxins to help with estrogen detoxification, heavy metal detoxification, all kinds of things. It helps as an antimicrobial. It's an laxative, so to speak, as it stimulates motilin, your motility hormone. All these things are really, really important for your bile flow. But what happens is that it backs up and it gets into the bloodstream. And then you have this intense itching. So hands and feet are the most common places for it, but you can also get systemic, like whole body itching. Now, there is something to be said about just like belly itching. I had the belly itching. I'm sure you did too as things were expanding. Yeah. This is different. You are going to know if you have cholestasis because it's mostly at nighttime that's happening. And it's the hands and the feet telltale, but can be all over. And so it's really important to pay attention and to talk with your, of course, OBGYN, your doctors, your midwife, whoever it is that you're working with, because this can be harmful. However, I've done, and then the notes that I took were actually from a really great podcast with the Natural Nurse Minded Mama, Dr. Charlie, and a few others, where when we look at the stats of stillbirth, it's not as scary as they're just going to try to like make you think. So that's what we also wanted to bring to light today, because this is not something that's often very common. It's like 0.3 to 0.5% of pregnancies. So like 0.5% of all pregnancies are going to get cholestasis in pregnancy. It's not super common, but it does need and deserve attention. And the good news here is that it can resolve after delivery. The other thing that we want to touch on, and we'll do this as we wrap up, what you can do naturally, how to support, because there's not a whole lot conventional medicine is going to do. And there is a lot that you can do from a symptom management perspective and just to support your liver, which I think you should be doing throughout pregnancy, which we're also going to talk about. Yeah.
And this is just stuff that hopefully the to-dos at the end will also just be general things that can be very helpful, because postpartum, we know, is also one of the most common times that people get their gallbladder removed. Mm-hmm. And so all of that comes back to liver health, bile flow health, and the things that we're going to talk about are going to be all of that. So some signs and symptoms. Liz mentioned the intense itching, the worst at night. God, brings me back. And Liz actually texted me the other day. She's like, when you had that really bad itching, what were you doing? Because I don't know if it was cholestasis. I was having the pale stools. Mine was more my chest and my stomach. That I was getting the itching at. This happened to me like 3 years ago, and I had a Giardia infection, like a really bad Giardia infection, that got kind of released through some uneducated self-treatment at the time.
So, like those Facebook groups, and they say like, hey, should I do a parasite cleanse or a detox? Yeah, don't do that shit. And this is the reason why.
This is the reason why. So like quick story time. I was like very early on in my functional career at this time. I was basically self-experimenting with some things at this time. And I was like, I'm going to try mimosa pudica seed, which is a very strong antimicrobial, like very strong, and didn't have binders in. I also at this time was like doing some castor oil packs, but I would get really itchy from them. And I would get like a sore throat the next morning. You guys, if anyone has liver issues, it was me. And I decided to throw mimosa pudica seed in there. And I pretty much immediately broke out into a full body itching and rash. Steroid pack didn't touch it. I took a while to even go to the doctor at first because I was like, I'm going to use natural treatments. I'm going to try some tea tree oil on my skin. I'm going to try, ice packs. I'm going to try vitamin C. I'm going to try all these things. Nothing touched it. I was like in the middle of the night up with ice packs on my chest, trying to get myself able to fall asleep again. It was horrible. I remember traveling with it, and I went to a wedding, and I was in a dress that was like a polyester dress. I unzipped the dress in the middle of the wedding, and luckily it was cold out and I had a coat on. So like no one noticed. That's how bad this was. And ended up getting a steroid shot. I had to get a steroid injection to calm it down. But I was also at the time having like pale colored stools. I was exhausted. I was like, couldn't work out. I was taking naps during the day. Good old ivermectin saved my ass. But all of these things were going on. So I'm pretty positive I had some level of cholestasis happening, even though mine was not on the hands and the feet. So in these situations with the pregnancy, typically it's on the hands and the feet. It can spread. There's not always a rash though. You might get like little red bumps, dark urine, which is typically a sign of liver burden, like later stage liver burden, and light colored stools. So almost like a yellow sandish type consistency, fatigue, and then yellowing of the eyes or the skin. So break it down. The itch is the first flag. It can come and go. But if it gets worse or spreads, that's usually your cue to kind of check this out. And then there's rash that can happen. It's called pruritic, urticarial, papules, and plaques of pregnancy. PUPS. Separate
Don't
thing.
hate on us here for the medical terminology.
We're just trying to bridge the gap, guys.
What it's called.
They are itchy red bumps on the belly. So they're typically more linked to skin stretching and histamine release, not bile backup. Still annoying. Not as dangerous, though, that cholestasis can be. So the itching, and honestly, a lot of times, like not always that rash is more of like the cholestasis potential. Yeah. So talk about some labs.
Yeah. And I want to say too, for those of you who maybe experienced this or you have family history, of this, there's a few reasons why this can happen. And in pregnancy specifically, it's hormonal changes and there's not a lot you can do about it. Like it's not your fault. I think that yes, supporting your liver and your bile flow is going to be really important because if we're talking about non-hormonal related changes, the hepatocellular damage that occurs is because the liver cells themselves are not able they're basically impaired. They're not able to function properly, and they cannot produce or secrete bile efficiently. And there's a lot of reasons why this might be happening. So the bile duct system is miles in length. There's so many nooks and crannies, just like the GI tract, where things can get blocked. Yes, hormonal changes play a role here, but also malabsorption, miscommunication cellularly. We're thinking about toxins and BPAs and mycotoxins and mold and just all the things. Just know that this is in pregnancy, not necessarily something that you can always control, right? So 2 big things that they are going to check are lab work, right? So number 1 is your serum bile acids. This is the big one. A level above 10, which by the way, optimal is 4 to 7.8. And we'll talk a little bit more about this, but a level above 10 is going to confirm that diagnosis of cholestasis in pregnancy. Over 40 is concerning. And so they're going to watch it. They're probably going to bring you in weekly to run bile acid markers, but over 100 is serious. And that is going to be when they monitor you a lot more closely. And in some case, they will do, an early delivery. Okay. So serum bile acids show if bile is backing up out of the liver into blood, right? Serum via the hepatic vein. If serum bile acids are elevated, this is the indication that bile is not owning to the gallbladder and small intestine as it should. It's not flowing there, So if we see this, even on sometimes constipation cases, I'm running bile acids, I'm wondering what is going on here? And I see that it's elevated. This is a good indicator. So you don't necessarily have to have gallstones to have a gallbladder problem. And many people mistake this. They think that, I got a scan and they didn't see any gallstones. Really, unless you're getting in there with a HIDA scan, CT scans, ultrasounds aren't really going to show everything essentially, right? So I like this. It's a simple blood test that can be done. We sometimes do it as part of our panel because this is really important as well when we think about oxidative stress and toxin exposure. A lot of times when we're dealing with mold and mycotoxin illness, we are going to see that the bile acid markers are elevated. So the second thing that they're going to look at is liver enzymes, ALT, AST. These might not always be elevated. A lot of times they are, but I would also be checking your metabolic panel to look at overall liver and kidney function. I'd also be checking for things like bilirubin, GGT, some of the other markers that give us a little bit more insight into what's going on. But those are going to be the main 2 things that your conventional medicine doctors are going to check. So the serum bile acids and then the liver enzymes. Now, what do we do from this point that we are given this diagnosis? Obviously, I think the severity is going to matter here. Your doctors are going to talk to you about where you're at, and then they're also going to monitor you very closely because for baby, this can increase the risk. So preterm birth, fetal distress, and then stillbirth, this is more, especially when bile acids are over 100. And so I did a little bit more digging here into some of the research because as a mom, and as somebody who has dealt with pregnancy complications, we had Marcus at the 20-week completely look fine. And then by the time we got to 32 weeks, they're like, oh, he has IUGR. Your placenta basically crapped out. He's not getting what he needs. And you're like, oh my gosh, maybe it was even 28 weeks. But I remember we were monitored. We were going to all the maternal fetal medicine specialist appointment. It's really scary. You don't know what is going to be the next route that they take. And so we don't want to fearmonger people here, but obviously we want to know that there is a risk. So the risk of stillbirth by bile acid levels, I think this is the important part versus just out there hey, you are at a higher risk, right? Well, let's talk about what that risk is. So when we're looking at that mild cholestasis of pregnancy, bile acids between 10 and 39, your stillbirth risk is approximately 0.3% to 1.3%, comparable to just a general pregnant population, which we also know still has some risk, right? So there was a large study from Kaiser that found women with bile acids between 10 and 19 had a stillbirth rate of 1.3, while those with 20 to 39 did not show a significant increase in risk. So they're basically found in this study that between 10 and 39, the risk remained the same. Okay. Moderate bile acids 40 to 99. Stillbirth risk still remained about 0.3. Same Kaiser study reported no significant increase in stillbirth rates for that group. Now you take it to the severe level where bile acids are over 100. That jumped pretty significantly, 6.8%. So significantly higher. And then again, this is of course going to be something your OBGYN is going to be monitoring you very, very closely.
Yeah. So, and I mean, honestly, under 100, it seems like there could have even been research always is going to have a little bit of that, like, well, was it just that research study that showed that increased risk? Like, it really seems like the risk jumps after 100.
Right.
So do not fear if this is something that you're dealing with. We didn't, you don't want the additional stress in the pregnancy. But what can we do? So there's something called the brewer's diet, and it was designed for preeclampsia prevention, and it's also very helpful here. High in protein, 80 to 100 grams minimum of day, healthy fats, calories up to 2,600 depending on the person, sodium. Yes, you do want sodium in this case because it helps support healthy blood volume, liver function, and nutrient status for mom and baby. Because when you increase blood volume in the body, which blood volume increases substantially when you are pregnant, you need additional electrolytes and hydration and nutrition. Liver-loving foods, so beets are great, dandelion greens or tea here, lemon water, anything bitter. So bitter is your friend when it comes to the liver, bitter and liver. Bitter greens before meals, you can support with bitters as well. I love bitters. Digestive bitters is like such an amazing product. It's digestive enzyme support, bile support, liver support, and you can get it. We like the Quicksilver brand bitters on Fullscript, and you take it before a meal. Herbs with a practitioner's guide. Milk thistle can be a gentle liver support. Dandelion root. You can get dandelion root tea, peppermint or ginger tea. You can mix them together. I actually really like dandelion root mixed with peppermint tea, like the 2 bags in 1 cup of tea. Acupuncture can be really good for calming the itching and supporting liver function. Topical relief, oatmeal baths, cold compresses, calamine lotion. It does not fix it, but it can help soothe it. And then some other herbs that can be pregnancy safe and breastfeeding safe. Lipo-X is from Supreme Nutrition. We love Supreme Nutrition. Helps with glyphosate, herbicides, pesticide detoxification. It's a liver support, anti-inflammatory. Takesumi, Supreme, also a binder from Supreme Nutrition. So this helps with detoxification, helps with trace minerals, intestinal upset. And Illicium Supreme is a broad spectrum antimicrobial. So that is also from Supreme Nutrition. They honestly just have like such great products, and a lot of them are pregnancy safe. They note which ones are pregnancy and breastfeeding safe.
Yeah, these 4 that I put here, I took 3 of them in my pregnancy. I did not take the Illicium. I didn't need that, but I did take the Lipo-X, the Takesumi Supreme, and then also grass-fed sheep liver, which sounds kind of strange. But I took this because this is, it's really nutrient dense. It's got a lot of B12, folate, K2, and choline. All of those support methylation. Okay, methylation is a process that relies heavily on phase 1, phase 2 detoxification, conjugation. And when we think about choline, especially in pregnancy, choline helps with bile acid flow. And this is really important for fetal development too, and neurological development. And so I personally, based upon the research shows 930 milligrams of choline daily for supporting fetal growth and development. I took the PCOS doc prenatal, but also the grass-fed sheep liver. I don't think you can like overdo it. The PCOS doc put 900 milligrams, so almost that 930 milligrams. And basically what they found, and they followed the children, I believe up to age 7 in the research, that they had better attention spans. They remembered things. They didn't deal as much with neurological disorders. And so I think, why not? There's so much research around it. Dr. Lily Nichols, or she's a registered dietitian, she was on the show. She has a few different books on pregnancy and what's really important. And a lot of these would just kind of align with that. But, when you are pregnant and you're going through this process and you're like, man, what is going on? What is maybe driving this? I would also add in the Tiny Health gut test here is really important. They have one for pregnancy, and even, going through a little bit of protocol with obviously pregnancy and breastfeeding safe herbs can be very effective because you pass things on to the fetus. So as Becca was saying with like that Takesumi, metal and chemical chelator, detoxification, endotoxemia, that drives liver inflammation. So if you're taking something to calm that down, you're probably going to see better result with your bile acid flow. And then so I would just say the final tips here is, number 1, trust the itch. If you find those hands, those feet, you're up all night, anything with pregnancy, call your doctor right away. I definitely was that person that was like, is this normal? I also called after Ethan was born because I forgot that they just sound like pugs and they're so noisy. And I'm like, is this child like gonna die? Like, what's going on? You know, he's like in the bassinet. You just kept getting up every 5 minutes looking at him like, is something wrong? Oh no, that's normal. I just forgot that about newborn life. And then don't ignore nutrition. Your liver needs love. Food is a very powerful medicine. Of course, if you're struggling and you're sick, nauseous, B6, right? Ginger, all those things, getting a prescription from your doctor can be very helpful to make sure you can get in the nutrition that you need. But if this was helpful for you, if you know somebody who's maybe pregnant, getting pregnant, and they're like dealing with this, some of these natural supports, you know, in addition to that monitoring, can be very helpful for symptom relief. And like we said, the good news is it generally resolves post-pregnancy. So don't forget to rate, review, subscribe, share the show with somebody who needs this. And if you do share it, tag us so we can see that you shared it.